Hello, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk about today is the benefits of the pull on back. Pull being, even like a hot tub or some sort of thermo spa type thing, or regular full-size pool activities. So at first, I'll talk a little bit about the spine and some of the reasoning for the pool being beneficial, and then we'll go a little bit into some things that you can do, some things to try, and some things to avoid. So continuing on, let's talk review about the spine first. Hopefully you can see my screen here. So the spine, this is a good picture. All these images I've just borrowed through searching Google. But you've got your cervical spine up top here, which is your neck region. And then this big middle region is the thoracic region. That's your mid back. These are where all your ribs are here in the middle. All your vital organs and everything are encapsulated in here. And then your lower back, which is the area that people mostly have trouble with, is down here, these lower ones down here at the bottom. So there's a good reason for this picture is this line drawn down the middle. This line is supposed to be the central axis of the spine, and the axis is the typical point where gravity is going to act upon the body. The gravity is constantly pulling on every part of the body, every part of your mass. However, your spine has a natural alignment to try to orient that gravity line as middle as possible to maintain your posture, but also reduce excessive forces to one side or the other. When we have poor dietary habits, we're overweight, when we're have structural changes in the spine, the body can't maintain this force of gravity as well, and that leads to potential breakdown in some of these areas, these vertebrae. So the pool is essentially the reason that the pool is beneficial is because some of the properties of the fluid, the water that's in the pool, helps to slightly negate the force of gravity. Gravity is always acting upon us, as I said. It acts on all of our mass, and it's constantly having a compressive pulling effect on our spine. But some of the properties of the water and the fluid help to reduce some of that compressive force and allow for a little bit more mobility and a little bit less pushing on sensitive structures of the spine. So I want to talk a little bit about some of the properties of water. Again, I've just borrowed these images from Google. So the main benefit of the water is the property of buoyancy. So this picture shows a mass, just any certain object has a certain mass. My body has a certain mass, somebody else's body has a certain mass, and the force of gravity is always pushing down and providing a compressive force on that mass. Now, depending on the density of that mass, it may be more likely to sink or more likely to float. But some of the properties of water are it provides an upward buoyant force, which helps to reduce some of the downward compressive force of gravity. So if you think about it like this, if you've got your spine, so let's go back to the spine, and hopefully you can see let's go to the lower spine just because it's better. So there's these individual vertebrae, which are the white bones, and between are the discs, these bluish colored regions. And then coming out either side of here are nerves that supply your organs, supply your muscles, everything. And they need a particular space to operate properly. So normally your discs and your bone provide that structural space for them to be able to get through. Now, if you've got arthritis or if you've got something like degenerative disc disease or some other problem, that space is essentially narrowed, and then the discs, disc height can be flattened, providing a lot of compressive force to some sensitive structures here. Now, the buoyant force of water helps to negate some of that force of gravity to, instead of everything being so close proximity and pressed, is just a little bit more space. And even that little bit of space is enough for your muscles, your joints and everything to move a little bit more fluidly and to allow for more space for those nerves to have enough surface area and enough pathway to travel through where they're not getting short circuited. So that's one of the benefits. So buoyancy is the main item of interest with the fluid, with the water, providing that supportive upward force. If you've been in a pool at all, you've experienced this force because you have that supported feeling when you're in the pool, because our body has a certain natural mass, and that mass over a certain surface area and a bunch of other physics equations. But essentially, it's that upward force that is supportive. And as I said, different masses have different buoyant forces applied based on their surface area and how much density they have, how close together that mass is. So something like a sponge is, the buoyant force is very supportive. Something like a wood block, it may be a little less supportive because that mass is a little bit more dense, but the buoyant force can still negate something like gravity. But a big piece of steel is just going to sink because that object is so dense that the buoyant force can't overcome the pushing down compressive force of gravity. So now that we've talked a little bit about buoyancy, we need to talk a little bit about the benefits. So as we said, it decreases that compressive force to the spine, which allows for your nerves to have a better pathway to travel so you get a better signal. It also helps reduce some muscular strain because your body is constantly trying to keep yourself up against gravity, and different muscles are trying to have to act to right themselves, and they're constantly having to work, and these muscles get fatigued and they get stretched out or they get compressed depending on where their origin and insertion are, and different areas can be overworked. So the buoyant force of water just allows everything to be a little bit better alignment to allow those muscles to relax a little bit and not be overworked. Water also, there's a property of water or any fluid called hydrostatic pressure. And essentially hydrostatic pressure is a force provided by that fluid acting all over the surface of the object, depending on the object's individual surface area. There's a certain amount of force that acts upon. Depending on how high in the water column, meaning how shallow or how deep you are, there's different levels of forces applied. But that hydrostatic pressure has a couple of benefits. One, that natural pressure of the water provides a little bit of resistant load to the body, meaning that it's going to work your muscles subtly, but it's going to work them a little bit harder than you would normally walking or doing activity just during your daily routine. It also, having to work your chest has muscles that expand and contract when you breathe, and it has to work those a little bit harder, just very subtly, but it has to work those harder, helping your heart, your cardiopulmonary system. The warm, backtrack. When we talk about doing aquatic therapy or aquatic activities or anything beneficial to back pain, you want to find warmer water. There's a couple of reasons for the warmer water. One reason is that it has sort of a relaxation effect on your nervous system. The second reason is your musculature. If you've got musculature that's overworked or is strained or stressed, it can have a little bit of a relaxing effect on that musculature, just to reduce some of the forces that may be uneven with your body trying to naturally right itself. Because of that buoyant force of the water pushing up, you have a little bit more what's called a range of motion to your joints, all of your joints, your shoulder, your knee, your hip, everything just has a little bit more room. So if you can imagine your joint is, so here's a ball and here's a socket. There's a lot of ball and socket joints. So if you've got gravity acting on it all the time, it's constantly providing this compressive force. But if you're in the water and have the buoyant force, there's just a little bit more space for things to operate. Just providing just a tiny little bit more mobility. It also, depending on what your level of activity in the water is, what you're doing, you can also build some supportive musculature. Woo, didn't mean to go out that far, of the back. So all along the back here, you've got basically a deep layer and a more superficial top layer of muscles that are constantly supporting and working the spine. And you can strengthen some of this stuff utilizing the properties of water to better support your body and build some of the strength for when you're out of the water, working some of that in a less intensive manner. The hydrostatic pressure of water also has an impact on your dynamics of your bloodstream. Because of that force pushing on your muscles, your bloodstream and your heart and your lungs have to work a little bit harder to push fluid throughout the body to overcome the hydrostatic pressure and the force of the water. So in turn, you get a little bit better blood flow to your musculature, sometimes your brain. It can help your alertness a little bit too. And that blood flow helps to, one, supply your body with the nutrients it needs. If you've got those nutrients floating around, it can better supply everything. But also any bad stuff, any bad metabolites or waste products that have developed in your muscles, your cells, that can be taken back up through your system. So there's a couple of tiers of water activity that I would recommend. I would recommend one, finding a pool that has a shallow end, that the water is warmer. Luckily at Presbyterian Village, they have certain regulations as far as the temperature and the height and all that. So you're at an advantage as far as having a warm pool with appropriate construction that can allow you to do some of these activities that I'll recommend. But the first thing I would recommend is just standing in the water. You want to go at least, I would say, probably above your hips, maybe to your lower chest level. That way you have a little bit of that buoyant force acting upon you. And then just try regular walking, maybe taking a few steps forward, turning and coming back. Just basic regular water walking. That's a good introductory to spinal health with using the pool. If you're doing well with the walking and you're not really having any increased discomfort or problems, you can move to walking forward and then walking backwards. So you're going to utilize some of your pelvis and your support musculature down here a little bit more, walking backwards. So walking forwards and then backwards walking. Then you can move to swimming. When thinking about swimming, there's typically the school of thought is that you want to avoid any kind of hyperextension of your back. So I'm going to try to demonstrate here. So when you're sitting here, you've got a certain posture and you're extended, meaning this is upright and you're more straight. Hyperextending would be really exaggerating the curvature, and you want to avoid that. So certain strokes, like I would say the butterfly stroke or the breaststroke, may increase that extension a little bit. So really, freestyle, just forward swimming, or even the backstroke is probably more ideal. One, it's keeping you in better alignment, but two, you're not providing that extension, that hyperextension that may hurt. So I would say probably just regular freestyle swimming or the backstroke are the ones to do. You can then, if you're doing okay with that, you can try some gentle exercises. I don't have any pictures, but I'm gonna try to describe these as best as possible. So the ones that I would start with is just basic marching. So just slowly bringing your knee up towards your chest, and then slowly bringing your knee, your opposite knee up. Just marching one leg, marching the other leg. You can modify this and progress this a little bit by, if you go to the side of the pool and with your back to the edge of the pool, draping your, I'm not doing a very good job of showing this, but draping your arms over the curb or the side of the pool, and then slowly marching, lifting your leg up. So you can do that, and then as a progression, you can try to bring both legs up. Try to slowly bring both legs up at the same time, and then slowly back down, and then slowly bring them up, and then slowly back down. Some other good activities would be if you face the wall and you're putting your hands on the edge of the pool, trying to just allow your body to go flat. So if you think about bringing your legs up, so you're essentially face down in the water, but have your head up so you can breathe. Just extend it out with your arms extended and your legs extended. That's another good position that's typically recommended. Something else you can do is also, as we said, sitting on the, or not sitting on the edge, but holding onto the edge with your back against the wall, trying to do like a bicycle movement. So large, controlled, scaled movements, big scale movement, but slow. Pace these well. You can also work on your balance and your postural control muscles a little bit. You can go more towards the shallow end and work on standing on one foot. But you can also, if you have a noodle or a kickboard or something like that, that has that supportive buoyant force, you can sit and try to balance or maintain upright posture while, for a minute or some sort of time frame to really engage your core musculature and your supportive musculature to your back. I would say start small. So if you're walking, maybe walk for like 5 minutes or something like that, and then work up. If you're swimming, go slow. Maybe just do a couple laps and then take a break, and do a couple more laps, and just build up your tolerance. Because what's going to happen is because of the hydrostatic force of the water and the resistance, you're going to develop something called delayed onset muscle soreness, which you may feel fine when you get out, but then later on you may feel really sore because your body is trying to adapt and recuperate from that activity, that resistive activity. Even though it doesn't seem like you've done a lot, your body has steadily done a lot of activity. So some considerations for the pool. Water shoes. Water shoes, even though the pool has that buoyant force and is supportive, water is typically slick. It doesn't have a lot of that friction force to maintain good grip, so strongly consider wearing water shoes. Water shoes that are appropriately fit. That you want to consider that post-activity muscle soreness, the delayed onset muscle soreness. So allow yourself time to rest afterwards. If you don't have any medical conditions that are contraindicated for it, maybe think about later on using a heating pad or something like that to alleviate some of that muscle soreness, and slowly build up. Something else to consider is if you have a history of heart trouble or blood pressure issues. That hydrostatic pressure of the pool is going to inherently make your heart and your lungs and your blood vessels work a little bit harder than they used to. So when you get out, be very careful, because you may be more likely to fall, not because of slipping, but because of getting dizzy or lightheaded or something like that. So a good consideration is maybe slowly getting out, like taking a couple steps up the steps and then acclimating yourself a little bit, and then taking a couple more steps up the steps and then acclimating yourself a little bit more, and then just slowly working back to gravity and the atmospheric pressure to reduce the risk of your blood vessels in your heart and your brain and everything sort of going into a reactive shock, and then blood pressure dropping or having some sort of arrhythmia or something that would lead to a fall or another event. So if you have any major heart issues or major blood pressure issues, just be very cautious. You may even want to consider consulting your doctor before doing any kind of pool therapy or pool aquatic activity, just to be sure that it's a safe environment for you. So that's about it. So again, some good considerations are starting slow. I'm sorry. Just walking in the pool is a good place to start, but then you can do some activities like marching, sitting on a pool noodle or a kickboard, trying to bring your knees towards your chest, or doing bicycle movements, sitting on or holding on to the side, and then having your hands on the side and allowing yourself to go flat in the water, but keep your head up so you can breathe, of course. And then if you're tolerating the activities well, you may want to consider like a aquatics class or something like that. That's a little more intensive, and adds a little resistance sometimes, just to improve your heart endurance, improve the strength of the supportive musculature. And it's just nice to have a guide to show you some beneficial activities and to work in a group. People are a lot more engaged and a lot more willing to do activities in a group versus independently on their own, at least typical psychology. So that's about it. Again, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.